5 minutes. The American people want us to work together to address their top priorities, creating jobs, turning the economy around, and reducing the deficit. The Republican majority told the American people, vote for me. That's what we are going to do. This is a classic case of bait and switch. Their first order of business was to repeal health care reform, the results of which would add to unemployment, add to the deficit, and delay the economic recovery. And today, by denying funds for the implementation of health care, they are at it again. This amendment would take away the consumer protections of the Affordable Care Act, put the insurance companies back in charge, a further demonstration of the majority's special interest priorities and their hypocrisy on job creation and deficit reduction. Repealing health care will destroy jobs in the health professions. It will slow growth by 250,000 to 400,000 jobs a year. It will increase medical spending and add nearly $2,000 to the average family insurance premium. According to CBO, repeal would add $230 billion to the deficit in the first 10 years and $1 trillion in the second 10 years. And let me repeat that. This amendment adds billions and ultimately trillions of dollars to the deficit, and it starts next year with $2.2 billion. And what my colleague will say that in the rest of this year, that isn't the case. One needs to just look at what the CBO said overall on the $5.5 billion in deficit that this would create. This is not what they promised the American people. This amendment will allow insurers to charge women 48% more than men for exactly the same coverage. It allows insurance companies to once again discriminate against Americans with pre-existing conditions, even children with pre-existing conditions. Women may again be denied coverage because they survived breast cancer, or because they were a victim of domestic violence, or because they had a C-section. It will deny up to 4 million small businesses $40 billion in tax credits. This amendment will increase drug costs for seniors. It will take away the 50% discount on brand-name drugs for those who have found themselves in the donut hole. It will increase also seniors' health care costs, making life-saving preventive services like mammograms, colonoscopies, wellness visits, blood pressure screenings, and diabetes screenings more expensive. This amendment will cost money, and it will cost lives. In Connecticut, 191,000 children with pre-existing conditions benefit from the health care reform law. More than 540,000 seniors with Medicare coverage no longer have out-of-pocket expenses for recommended preventive services, and up to 15,400 small businesses in my district alone will benefit from these tax credits. If this amendment passes, what will happen to children with pre-existing conditions, to seniors in the donut hole, to small business owners trying to help their employees find quality health insurance? I urge my colleagues to vote against this irresponsible amendment, and I reserve the balance of my time.